when we talk about things like, blood glucose and things like that, I find it interesting that a lot of these kind of spikes and dips, it's internal, right? So you can never really um, know how it feels in someone's body. We can only kind of describe it. Um, how do you kind of help patients kind of gauge what their body is doing? How do you navigate those conversations to make sure that they kind of regain a sense? Because if this is something they've been struggling with for a while, maybe sometimes people normalize the feelings that they have, and it's only after a while that doctors like, you're actually not supposed to be feeling this way at this time of the day or this way after you eat this type of meal. Have you come across those conversations, and how have you kind of bridged that gap so that the patient can maybe more accurately say what they are feeling, or just kind of recalibrate if they've been living for a while, feeling something?
Yeah, so for diabetes, it comes with symptoms, and some comes with awareness of those symptoms. Sometimes they are not aware of the symptoms. My goal as a physician is to make sure, if, for example, they are having hypoglycemia, that they are aware of the hypoglycemia. And if they are not aware, I had to, that gives me concern, because I want to make sure that if your sugar is low, you should be aware of it. And that should help you to be able to prevent further complications of hypoglycemia. When it comes to hypoglycemia, for instance, the symptoms are also out there. For thyroid, for instance, the symptoms are there, so they can they can feel the symptoms and the like. But most importantly, I monitor them with blood work, because endocrinology, most of what we do, it's requiring blood work. So when they see their blood work 3 months ago and compare it with their blood work this at the present, they see their progress or their regression, and we can have a talk and dialogue. What can you do better? This is your blood pressure today. This is your blood sugar today, as compared to your blood sugar 3 months ago, as compared to your thyroid hormone level 3 months ago. Are you taking your medications as you should? Are you forgetting to take your medications? Are there challenges that you're having in refilling your medications? Is there a problem, that anything that we can fix while we dialogue? So it all comes down to having to listen to them, uh, pay attention to patient, because they say a lot. Patients will tell you many keys that you can understand where you can help them out. Yeah. So, and from there, we've been able, or I've been able to be able to bring out solutions
Mm.
and applaud them, encourage them when they are progressing. And if they have anything that they are worried about, we can discuss it that as well in detail. Um, Other thing I would say is that when they feel like they've tried and still no improvement, that sometimes can happen, because medical conditions like diabetes sometimes can be very challenging. When they've given all they want to do, they've tried their diet, they've taken their medications, and still the disease is progressing, or they are not feeling better. At that point, I let them understand, like, it's okay. Life can be very challenging to address things, and then we talk more in detail on how else we can help out. So it's all more boils down to having to listen to them more,
Mm.
see little areas and big areas that we can adjust.